Rahim. Assalamu alaikum students. Today we are going to discuss chapter number 13 of book 2. Hero number 3, Sir Alexander Fleming. Written by Patrick Pringle. Sir Alexander Fleming was a Scottish bacteriologist. He discovered penicillin and he was given the title of Sir for his discovery of penicillin. He was born in 1881, died in 1955. In today's video we will discuss Sir Alexander Fleming, Louis Pasture and Lord Lister. We will be discussing services of both these scientists, mainly Lord Lister and Louis Pasture. We will also discuss brief life history of Sir Alexander Fleming. So we'll start from Louis Pasture and Lord Lister. This chapter says Pasture discovered germs and Lister killed them. These two men together revolutionized the theory of practice of medicine. Let's see who was Louis Pasteur. Louis Pasteur was a French chemist. He discovered that disease was caused by living organisms so small that they could not be seen without microscope, and they could not be seen with the naked eye. Microorganisms are microbes or bacteria or germs. The words all mean the same thing. His idea was that he was a French chemist. His idea was that diseases are caused due to living organisms. Let's see what does Joseph Lister say. Joseph Lister was an English surgeon, later Lord Lister. He was given the title of Lord. The first medical peer applied Pasture's discovery to surgery. He was peer mean companion. Applied Pasture's discovery to surgery. Since germs are alive, germs can be killed. Idea was given that since germs are alive, so germs can be killed. They can be destroyed by heat or poisoned by certain chemicals called antiseptics. Germs can be killed with the antiseptics. The best antiseptic known at that time was carbolic acid. Carbolic acid is one, and that was a germ killer Lister used. Previously, surgeons had, without knowing it, infected the patients on the operating table with germs, chiefly from their surgical instruments. Before Joseph Lister, all the surgeons used to infect their patients on operating tables with their surgical instruments. It was Lord Lister who sterilized his instruments with carbolic acid and used carbolic acid to kill the germs. On his hands, on the patient's skins, and even in the air in the operating theater. Then he could cut his patients open without fear of infecting them with the germs of disease. What was Lister's aim? Lister's aim was the prevention of the disease. We are discussing the services of Joseph Lister and Louis Pasteur. Lister's aim was prevention of the disease. The object of his antiseptic methods, as it was called, was to stop germs from getting into the body. The cure of disease was a more difficult problem, for here the germs were already inside the body. Certainly they could be killed by same antiseptic method, but it was soon found that a chemical that destroyed germs also destroyed the cells of the body. There was a drawback. There was a major drawback of antiseptic method. The drawback was that the same antiseptic that killed or destroy the germs also destroy the cells of the body, so it was very harmful to use. Injecting the carbolic acid into the blood was tried and quickly abandoned, for it did more harm than the good. To kill all the germs, the dose would have had to be strong enough to kill the patient too. It was major drawback of antiseptic method. What is antiseptic method? Antiseptic method mean to use the antiseptics like carbolic acid to kill the germs. It was a bacteriologist named Mechnikov, a pupil of Pasteur's, who revealed that the nature of the problem. Mechnikov was a pupil of Louis Pasture, who revealed the nature of the problem. He discovered the body's natural armor mean defense, against disease, the leukocytes or white cells of the blood. What is body's natural armor, natural defense? It is leukocytes. He showed that when germs enter the body, they are immediately attacked by a host of white cells from the whole neighboring areas, which rush to join battle with the invader. Invader mean attackers, like soldier answering the bugle call. Bugle call mean call for the war. He showed that disease was in fact a fight between leukocytes and germs, and fight to the death, for it ended only with the death of germs or the death of the patient. According to Mechnikov, what was the disease? He says that disease was a fight between leukocytes and the germs. Let's see what was carbolic acid and all other non-antiseptics. He goes on to say that carbolic acid and all other known antiseptics did more damage to the leukocyte than the germs. The problem was to find something that would attack only the germs and to help not destroy the fighting leukocytes. The problem was still unsolved in 1906 when Alexander Fleming passed the finals of his medical examination and joined the staff of inoculation department of St. Mary's Hospital, Paddington. In 1906, as we have read, he was born in 1881. In 1906, Alexander Fleming passed the finals of his medical examination and joined the staff of inoculation department. Inoculation department, the department of injections, inoculating the injections of St. Mary's Hospital, Paddington. Let's see a brief life history of Sir Alexander Fleming. We have read that he was a Scottish bacteriologist. He discovered penicillin and he was given the title of Sir, of which he was not proud. He used to say that I did not make penicillin. The nature made it. I just discovered it. And he was not proud of his discovery. Let's see his early life, his little brief biography, his short life history. Alexander Fleming was born on a farm near Darwell in Ayrshire on August 6, 1881. Fleming was born on a farm near Darwell in Ayrshire on August 6, 1881. He was youngest of his family of 8. He was the youngest son of a family of 8. His father died when he was 7 years old, and his eldest brother, Hugh, took over the management of the farm. Alexander was then still going to the village school. At 10, he went to Darwell School and stayed till he was 12. That was the age limit. The question was then discussed whether he should continue the education or go back to the land. It was decided to keep him at school and he went to Kilmarnock Academy. At 14 he went to London and for next 2 years he studied at Regent Street Polytechnic. We will repeat it. He got early education at Darwell School. After completing his 12 years, he studied at Kilmarnock Academy. He was sent to Kilmarnock Academy. At 14, he went to London for next 2 years. Means 15 and 16 years of his life, he studied at Regent Street Polytechnic. These are some important institutions of his education. Three of his brothers were already in London when he arrived. One of them, Thomas, had studied medicine at Glasgow University. Actually, he was a family member of a medical background. His family was a medical family. One of his brothers studied medicine at Glasgow University and was qualified. He was qualified oculist. Oculist means an optician, a person who cures the eye diseases of eye. Two others became opticians, and back in Scotland, one of his sisters married a Darwell doctor and another veterinary surgeon. The Flemings born on the land were becoming a medical family. But when Alexander left Polytechnic at 16, he was to take a job as a clerk in shipping firm in Leadenhall Street. There was not enough money for him to study for a profession or trade. His discoveries, his achievements, his job places will be discussed in next video. Allah Hafiz.